Mm, okay, we continue with oral contraceptives. Okay, first of all, the combined estrogen and progesterone preparations. Then there are also mini pills that are progesterone only pills, and there are pills that are for emergency conditions, okay, known as emergency pills. Here we'll look at combined progesterone and estrogen preparations. Okay, let's start. The estrogen used in these combined pills are ethinyl estradiol and mestranol. Okay, let me highlight that for you. Okay, these ethinyl estradiol and mestranol, and the progesterone used are levonorgestrel, norgestrel, and norethindrone. Okay, these are the estrogen and progesterone used in the combined pills. Okay, the combined pills, they are available in three forms. Okay, monophasic, biphasic, and triphasic form. Monophasic, biphasic, and triphasic form. The monophasic form has fixed dose of estrogen and progesterone. Okay, it has fixed dose of estrogen and progesterone throughout the cycle. Okay, the dose usually depends upon how the company prepares it, but usually the estrogen content is within 20 to 30 mcg, and the progesterone content ranges from 0.15 to 1 mg. Okay, the biphasic has fixed estrogen, but the progesterone varies according to the phase of cycle. Okay, and the triphasic, it has fixed estrogen but slightly higher in the mid cycle, whereas the progesterone increases in 3 successive phases of the cycle. Okay, moving on to the mechanism of action. Okay, how these pills work. Okay, number one is suppression of ovulation. What they do is, if you are giving a hormone from external source, okay, then what it will do, it will provide negative feedback to the hypothalamus pituitary axis, causing decrease in FSH and LH levels, and thus suppressing ovulation. Okay, the estrogen part suppresses FSH and progesterone suppresses LH surge. Okay, that is number one, suppression of ovulation. Okay, the number two, alteration in cervical mucus. Okay, it makes the cervical mucus thick so as to prevent the penetration or entry of sperm. The whole point is to prevent pregnancy, that's why alteration in cervical mucus. Okay, the third point is interference with tubal and uterine contraction. They do not allow the ova to come in time or come at all to the endometrium and meet with the sperm there. Okay, so they interfere with tubal and endometrial contraction. They also make the endometrium less suitable for implantation by causing static endometrial hyperplasia. These are the 4 points on how they work. Okay, now when to start them? When do you start oral contraceptive pills? Usually you start at the first day of your cycle, but day 1 to 5 is considered. But if you're starting after day 5, you should use condom as in backup. Okay, for the next 7 days. Okay, if this is a case of post abortion, then you can start on the same day. And if a lady has recently given birth and if she's lactating, then after 6 weeks. Then if she's non lactating, then after 3 weeks. Okay, ideally you start from day 1 to day 21. Okay, day 21 to 28. Okay, this is of usually cycle ranges up to 35 days, 28 to 35 days. It is considered normal. Okay, so day 21 to 28 days is also called pill free day. Okay, they usually, in a pack of pills, it usually comes in the there are 21 number of pills that are to be used from the day 1 to day 21, but some companies also make pills for day 21 to 28 also. Okay, now what are the benefits of oral contraceptive pills? Okay, benefits of oral contraceptive pills. Okay, there are two major types of benefits. One is obviously contraceptive. They protect against unwanted pregnancy. They are very convenient to use. They are not intercourse related like condoms, female condoms, and other means of contraception. They are reversible. On stopping, their action is reversible. Okay, and the second one is non-contraceptive benefits. Okay, we did contraceptive benefits. Now the second non-contraceptive benefits. Okay, improvement of menstrual abnormalities like regulation of menstrual cycle, reduction in dysmenorrhea, reduction in menorrhagia, reduction in PMS or known as premenstrual tension syndrome. Okay, and reduction of Mittels-Mark syndrome. Mittels-Mark syndrome. Okay, then protection against iron deficiency anemia. Okay, some of these pills, especially from day 21 to 28, have iron supplementation in them. Then therefore, protecting against iron deficiency anemia. It is more prevalently seen in lesser developed countries. Okay, and also these pills protect against health disorders like pelvic inflammatory diseases by making the cervical mucus thick, thus making it harder for the bacteria to enter. Okay, protection against ectopic pregnancy, endometriosis, protection against fibroid, hirsutism, acne, ovarian cyst, breast disease, postmenopausal osteoporosis. Okay, and importantly, they also, okay, this is important, they also help in protection against endometrial cancer, epithelial ovarian cancer, and colorectal carcinoma also. Okay. Okay, now moving on to complications of oral contraceptive pills. Okay, we divided them into two, major and minor complications. Okay, one of the most important complication of oral contraceptive pills is that they might lead to depression. Okay, this is due to the progesterone component that decreases the serotonin levels. Okay, first one is done. Let me change the color to a bit more brighter one. Okay, it's done. Second is hypertension. That is mainly due to fluid retention. They promote both estrogen and progesterone. They promote sodium and water retention, thus leading to hypertension. Okay. Okay. Uh, Third one is vascular complications, thrombosis. Okay, they are mainly due to estrogen component that increases factor 2, 7, 9, 10 and decreases antithrombin 3. Okay, thus they may cause arterial or venous thromboembolism. And the fourth one is cholestatic jaundice. And the minor complications are nausea, vomiting, myalgia, weight gain, acne. These are mainly due to the androgenic effect of progesterone. They may also create some problems in the menstrual cycle like breakthrough bleeding, hypomenorrhea, menorrhagia, amenorrhea, okay, and decreased libido is also seen. Okay, forget about these guys. Okay, forget about these guys right now. The contraindications of oral contraceptive pills. Okay, we can relate it to with the complications. Okay, like there are absolute and relative complications or contraindications. One is thrombosis. Okay, we already discussed this. Thrombosis due to estrogen. Uh, Second one. Okay, second one is severe hypertension or history of stroke. Okay, third one is heart disease. Fourth one is diabetes with vascular complications. Fifth one is migraine with vocal deficits. Okay, and moving on, if the patient has active liver disease, liver adenoma, carcinoma, then we cannot use oral contraceptive pills. Okay, if a lady is using oral contraceptive pills for long time, then she may develop liver adenoma, liver tumor that is highly vascular tumor, and it might bleed or rupture, and the lady will present with severe pain abdomen. Okay, you have to think it like that. Other contraindications as pregnancy, and if the mother is lactating and has been lactating for less than 6 weeks, then you do not use contraceptives. Contraceptive pills. If the patient has had major surgery, immobilization that is prolonged, then there is increased risk of thrombosis, and if there is estrogen-dependent neoplasms in the body, like breast cancer. Okay. Okay. Now, relative contraindications are unexplained PV bleeding. Okay, hyperlipidemia. Okay, to remind you that estrogen, it increases HDL and decreases LDL, and progesterone, it decreases HDL and increases LDL. Okay, the other one are migraine, depression, and diabetes mellitus. Okay, okay, one more point. Okay, counseling regarding missed pills. Okay, missed pills. If the lady misses her pills, what to do? Okay, if she misses just one pill, okay, remember, if she misses one pill, then instruct her to take the pill immediately as soon as possible after remembering, and continue the other pills. And if she has two pills missed, then take one of the forgotten pills 12 hourly and continue with rest as usual. Okay, if she has two missed pills, take 12 hourly and continue with the rest as usual. Okay, if there are two pills missed on the third week, okay, that is 15 to 21 days, or if missed, if more than two active pills are missed at any time, we advise her to use a backup contraceptive for the next 7 days. Okay, now the next one is, if any of the 7 inactive pills that some companies do make pills for day 21 to 28, then throw them away, throw the missed pills and continue with the remaining pills, and as usual start new pack as usual. Okay, I think we're done for today. No, not done for today, done with the topic. Again, any mistakes, any suggestions are highly welcomed. Thank you.